The title of my book is Ending Parkinson's Disease. And so my main disclosure is that I'm an author on this book. I'm one of the 4 authors. You can actually see the mission statement in my group right behind me. It's on the wall in my center to remind us every day why we go to work. It's improving the lives of people with Parkinson's. This is the mission statement of our team. This is the book. I'm going to talk a little bit about what's in the book and hopefully make you enthusiastic. The main reason for writing the book is this paper that I published in 2018 in JAMA Neurology, which is one of our leading neurology journals, together with my good friend and partner in crime, Ray Dorsey, in the United States. It describes Parkinson's as a fast-growing neurological condition. In fact, we now have 2 papers out to show that Parkinson's is the fastest growing neurological condition on the planet. We all get older, which is why we see dementia more often, stroke more often, also Parkinson's. But if you correct for the aging effect, Alzheimer's is stabilizing. In other words, the increase in Alzheimer's is exclusively explained by aging. Stroke is actually diminishing after correction for age because we're better at preventing strokes. And in this survey, there was literally only one condition that stuck out, and that's Parkinson's disease. It's the only condition in the world that is growing over and beyond the aging effect. And these are all examples of people who recently heard that they developed Parkinson's disease. You can see all these famous celebrities: Neil Diamond, Roger Bannister, the famous athlete, Paul Bocuse, the famous French chef, Glenn Tipton, the famous guitar player for Judas Priest, for the fans among us today. One of the more recent ones was Alan Alda, the famous actor of the program MASH, which you may remember from the 70s and the 80s. I think the most recent one was Ozzy Osbourne, who recently announced that he has Parkinson's. And you probably think, oh, these are all men, and it's correct. And Parkinson's also affects women. This is Linda Ronstadt, a famous folk singer in the United States. But Parkinson's disease is a bit more common in men compared to women. And we can talk a little bit about that later, maybe why that is. Women develop the disease less frequently at a higher age. They more often have the tremor dominant phenotype, which is the more benign phenotype. At the same time, women are underserved. They are less frequently seen in university hospitals. They have less access to advanced treatments. And in the late stages of the disease, they have more debilitating dyskinesias. So women have advantages, but they also have clear disadvantages. And because Parkinson's is growing beyond the effect of aging, we now think that Parkinson's is at least to some extent a man-made disease, just like the pyramids in Egypt. And this is a paper, a cartoon from a paper that Ray Dorsey and I also published. And it shows the relation between, on the x-axis, the horizontal line, is the growth in gross domestic product, your national income, if you will. And on the y-axis is the growth in numbers of Parkinson patients. And as you can see, the faster your economy is growing, the higher the rate of new numbers of patients. And the one condition that really sticks out is China, where, of course, they are now having their industrial revolution. And you may recall that Parkinson's was described for the first time in England in 1817 when they had their industrial revolution. Now China is having their industrial revolution, and now the disease is exploding in China. So we think that, and this is a photo taken recently in China. So we think environmental pollution, in particular pesticides used on our crops, but also solvents and heavy metals, are responsible to a large extent for causing Parkinson's disease. Yes, genetic factors do play a role, but particularly for very young patients. The older you are, the more likely that the environment is actually playing an important factor. And what is, I think, stunning data, this is from our book, this is the use of paraquat in the United States. Paraquat is extremely toxic to the substantia nigra. If you give paraquat to a mouse, it knocks out the substantia nigra, the black matter in the brainstem that is responsible for causing Parkinson's. or Parkinson's symptoms, it makes the mouse Parkinsonian, and there is a clear relationship between exposure to paraquat and the risk of Parkinson's. It's been banned in 60 countries in the world, including even China, but it's still used today in the United States, which is incredible. It's just incredible. What is equally incredible is that, for example, today in the Netherlands, we use the little sister of paraquat, which is chemically just a little bit modified, but it's otherwise very close to paraquat. And it's never been tested for toxicity. So all of us are being exposed to toxic chemicals, which we know are related to Parkinson's, and we're not doing anything about it. Meanwhile, Parkinson's is exploding worldwide. This is all in the book, and it's a call for action. So this is a paper in the New York Times. How come, and this is another one, this is chlorpyrifos, which is a Roundup, which is also toxic, and new work links Roundup clearly to Parkinson's disease. So in the book, we're just saying, this is unacceptable. We should step to our politicians. We should cleanse the environment, move towards biological farming. And just to make clear, I'm not blaming the farmers, not at all. In fact, the farmers are the #1 victim because they are the ones most likely to develop Parkinson's disease. Who I do blame is the companies who manufacture this. It's the lobby that keeps the politicians from banning this from our fields. And I blame, the politicians for not taking stronger action. But I think we need to do something about this. And this is in Dutch, but this is an interview in the Dutch NRC Handelsblad, one of our leading journals, where we discussed that in France, being a farmer is now recognized as an environmental hazard for developing Parkinson's, which is incredible. Germany is on the brink of doing this. And maybe this should be accepted worldwide, that farming is just an inherent risk of developing Parkinson's. But the problem is, it's not just the farmers. It's not just the people who live near the cornfields. It enters the food chain. In our book, we describe how in Hawaii, for example, pesticides have been present in milk in supermarkets, commercially available milk in supermarkets, how pesticides were present in the breast milk of mothers, killing of substantia nigra neurons in young children. So this is not just affecting farmers and people living nearby, it's affecting all of us. So the book is a call to action. We call it a pact. I'll come to that in a minute. And if you're interested to read more about this, this is where you can find the book on www.endingpd.org. You can also order it on Amazon. And just to make clear that I'm not sort of promoting my own income here, all the proceeds of the book go to Parkinson charities in order to support our efforts to end Parkinson's disease. So we're not making any personal profits here. All the proceeds go to the greater cause. So in the book, we call for a pact. And on the website, you can actually go to the website, even if you don't order the book, sign the pact, sign the Parkinson Pact, because the more people sign it, the greater our voice. It's a pact to prevent the disease in people who are still healthy. It's advocacy to raise more money for research. It's a call for better care models and for development of better treatments. That is the pact. And today I want to talk a little bit about care models, because I'm trying to collaborate with Natalie in bringing some of our Dutch healthcare concepts to Malta and to other places in the world. These are my co-authors, Michael Oken, Ray Dorsey, and Todd Shearer. Todd Shearer is the CEO of the Michael J. Fox Foundation. So what are the specific challenges in healthcare? One problem in healthcare is we ask patients with Parkinson's to come to the clinic where we take a photograph of what is otherwise a complex film that is evolving in daily life. We ask patients to drive all the way to the hospital, and we know that driving is unsafe for many people with Parkinson's, and the spouse often knows, as you can see here in this funny cartoon. But it's seriously, Parkinson patients have a greater risk of causing car accidents. So it's always safe to have yourself tested by an independent examiner. And then patients are sitting in the waiting room, taking extra medication because they want to make a good impression on their doctor. And of course, I don't mind telling my patients they're doing well, but what I really want to see is how bad they are doing, right? And they're being seen taking the test, doing the finger tapping test, practicing it, because they want to make a good impression on the doctor, which doesn't make any sense. And then, of course, the moment a doctor looks at the Parkinson patient, they're doing unexpectedly well. This has already been described in 1817 by James Parkinson. He called this kinesia paradoxa, the unexpected ability of patients to move remarkably well when under close clinical scrutiny or under moments of stress or anxiety. So much to everybody's frustration, patient is shining in the examination room, only to return home where the freezing reoccurs and all the disability is fully visible. Falls are not seen when you are in the clinic. Asking about falls is notoriously unreliable. And we are now sending our nurses into the patient's homes, and sometimes you find situations like this, where patients are grounded in their chair, eating unhealthy shit, whereas we advocate physical activity and a healthy diet. But this is what you see when you go into patients' homes. But you don't see this in your clinic. So one important message is that I think it is essential to at least see patients partially in their own home living environment. Just to make clear, I don't think telemedicine is a panacea for healthcare. I strongly believe in the importance of seeing patients in your clinic occasionally to make the diagnosis, to do a careful neurological examination, to build up an intimate relationship with your patient. I strongly believe that there should be a close personal link between the doctor or the physiotherapist or the dietitian and the patient. And that genuinely intimate relationship cannot be built through telemedicine. But once you've made the diagnosis, once that personal relationship has been established, then telemedicine can be very good for chronic care and to solve simple problems remotely. And it may then be better, actually, rather than asking patients to drive the long way to the hospital to only give a biased perspective of what is happening at home. I hope that is clear. And then the other thing, which is a great personal hobby of mine, this is my favorite cartoon, is Parkinson's is an extremely treatable condition because you can compensate for focal deficits. You see this tractor is missing a front wheel, but with a little counterweight, the whole system is functioning again. And this is a nice metaphor for Parkinson's. The lesion in the substantia nigra is the missing front wheel, but the lady who's acting as a counterweight is the compensatory strategy. And we now know that patients are very well able to compensate for their deficits. This is exactly what physiotherapists are using in their daily practice. I always think that optimal chronic care in a chronic disease like Parkinson's is treating, on the one hand, the primary disease process, the lack of dopamine caused by substantia nigra lesions. We do this with medication or maybe deep brain stimulation, but also to boost the compensation strategies using a physio, an OT, a speech and language therapist, dance therapy, yoga, and you name it. You need both. One is not better than the other, but you need both. And this is just a brilliant poster crafted by one of my patients, who's an artist, of all the compensatory strategies used by Parkinson patients to compensate for their disease. You may know of the patient that once made me famous in my life who was unable to walk but still ride a bicycle. There are people who cannot walk but who can dance or step over an obstacle, and the list goes on and on and on. And this is just brilliant because all the Dutch physiotherapists now have this poster in their examination room and they walk the patients through all these different strategies until they find a solution that is working for them. This is just a little detail. We identified 7 main categories with sub-examples per category for bouncing a ball when walking, or you can see it. And the good news is there are many professional disciplines that can offer help to people with Parkinson's. This is a cartoon from a paper we published in the British Medical Journal a few years ago. And we counted, I think, about 19 professional disciplines. Now, that's not to say that all 19 should always be involved, let alone at the same time. It serves to illustrate A, the complexity of Parkinson's, and B, how much is potentially possible in terms of being able to help people with Parkinson's. But again, it's always tailor-made individual service. It's never a one-size-fits-all. And then, after we published this paper, you remember this boy band. I think it's a Canadian boy band, but I'm not sure. It's called the New Kids on the Block. You may remember this. I think it's in the 90s. And we published a paper under the title The New Kids on the Block, because we realized that the 19 was actually incomplete. And these are additional professional disciplines that can potentially offer help to people with Parkinson's. Just think of a dentist, a urologist for micturition. Think of palliative care in the later phases of the disease. Think of an ophthalmologist for the very common and debilitating visual problems. Think of a pulmonologist. There's a huge issue now around respiratory issues in Parkinson's. So these are what I call the second layer of professional disciplines that can be involved in Parkinson care. And of course, and this is maybe the most important cartoon, this is my team at the Radboud University Medical Center. And the guy with the laptop is a patient. He's got young onset Parkinson's. And as you can see, we are not delivering care for him, we are delivering care with him. The patient should be part of the team as a full member, equally important, or the most important member of the team. It's not the doctor who's the son, it's the patient who is the son. And I think that's really important. And this is a very provocative cartoon drafted by Sarah Rigara, who is a young onset patient living in Sweden. She's one of my PhD students. And she added up all the minutes and seconds of contact with the medical system. Daar kan ik geen app voor vinden. And that's funny. It's my telephone thinking that I asked for help. And altogether, this added up to 1 full day per year of contacts with the medical system. And all the other, that's the red circle. All the blue circles is Sarah, the friend, Sarah, the PhD student. And this is such a powerful illustration that people are so much more than their disease. They are human beings with a life, with personal needs, hobbies, families, children, parents. And I think that's so really important. And this is a paper that is really a must-read paper. I wish I had been an author on the paper, but I'm not. But it was by a Dutch group of people who defined health, redefined health. You may remember that the World Health Organization once said that the definition of health is the complete absence of any physical, mental, or social unwell being, which makes none of us healthy, you know. I have a minor running injury right now, which means I am sick according to the WHO, but I feel fit as a horse, you know. And just, so what they propose as the new definition of health is the ability to adapt and to self-manage. And I think that is just beautiful, and that should be the purpose of healthcare. Not to eradicate every small problem, but to support people in their self-management. And I saw this image on Schiphol Airport on one of my travels. According to the WHO, this man is sick. According to the new definition of health, he is healthy because he compensates. He goes board surfing despite missing one leg. I think it's just, remember this image. I think it is so powerful. This is the new definition of health, and this is what we should strive for. Now, how to do this? What I've increasingly realized is that although neurologists are important, I oftentimes feel like a specialist on an island. This could be Malta, Natalie, I think. Natalie, Malta's a little bit bigger, but not much. But seriously, I sometimes feel like I'm a specialist on an island. And what patients really need, and Harry Potter already said it, is we need networks in healthcare. We need integrated networks. We don't need just a hospital where you go to, but we need an integrated networks. And one of those examples is the Dutch Parkinson net. This is the Netherlands. It is a huge country. Natalie can testify to this. It is no less than 280 kilometers north to south and 140 kilometers east to west. It's a huge country. And but it's entirely covered with a Dutch Parkinson net now. And we have trained over 3,000 professionals to become experts in Parkinson's disease. And the essence of ParkinsonNet is that we train professionals to become really good at treating people with Parkinson's by delivering an intensive 3-day training course, and then by making sure that patients are preferentially referred to these experts so they treat and see more and more patients. You can just send people to a training course, but if you don't see patients afterwards, all the knowledge is gone within a week. People have their baseline training and they increase their caseload. And they are enrolled in a program of lifelong learning. So they do follow-up courses 3 times a year, an annual conference once every year, e-learnings, etc. So they get better and better and better. At the same time, we heavily invest in empowering patients through educational programs, and I'll give you one example. And finally, we promote collaboration between the members of the professional team, but also collaboration between the professionals and the patients. Again, to emphasize that modern care means that patients are full members of the team. This is our annual conference where we bring people together. This looks like a historical image in this time of the Corona crisis. And this is what we do at our conference. You see all the colored key cords. And for example, blue would be the neurologists, orange would be the physios, yellow would be the speech and language therapists. So what is beautiful is during the breaks, people meet up and they can say, oh, you're also a physiotherapist. Oh, you're also a dietitian. And they learn from each other. But what we also do during the breaks is we bring the local networks together. So now what you see at each table is a physio, an OT, a neurologist, a dietitian, a speech language therapist. So now the team meets each other. And once people have seen each other in person, the next time you receive an email, it's no longer the same. So this is really beautiful. And then, of course, our great pride is Parkinsontv. In my hospital, we now have our own studio where we broadcast live television to patients once every month. We've done over 70 episodes, and it's a talk show setting where patients decide about the topics, which is never tremor or gait, but it's about issues that matter most to patients. It's about sleep, constipation, sex, relationships, work. And we discuss it. People can watch us live, or they can watch us offline later on. And we have already more than 10,000 viewers per episode. We've then done 10 episodes in the United States. And this is obviously one on dietary issues. In the United States, we've had over 1 million viewers. I mean, imagine 1 million viewers. Not all live, but most of them offline. So what about the results? I'll be brief here just to say that ParkinsonNet is not just a nationwide concept in the Netherlands, it's also evidence-based. We've published a whole series of papers in high-quality journals to look at the evidence base behind ParkinsonNet. And the bottom line is, it leads to better care, fewer disease complications, and to lower cost for society, which I think is hugely important. We see a 50% reduction in hip fractures, and Parkinsontv saves 30 million euros each year for Parkinson's care alone in the Netherlands. And for that reason, Parkinsontv is now growing fast internationally. We now have networks in California, in Rochester, in Norway, in Luxembourg. We're starting trainings now in Germany, in Italy, in England, in China, and hopefully very soon in Malta. So the key here is collaboration is the new competition. Don't do it alone. I had a few slides on the COVID crisis, but I think I will leave it here, Natalie, because that's less important now, and then open it up for discussion.
Okay, so well done, Bas. Very, very great. And everyone else clapping with me, I can see. If anyone has a question that you would like to ask Bas, write it down in the chat, and then Cassandra will take over the question. So down here you have a bar and there's a chat. So if you have any questions to Bas about Parkinson's.net, about the book, about anything, write it down, and then Cassandra is going to okay.
Can I ask him a question, please?
Okay, Joey's going to ask the question. Okay, Joey.
I fell down the stairs about 2.5 months ago. The problem is this. My left hand, I had a little tremor, but since I fell down, the tremor increased. What's the reason? Why?
Yeah, so maybe it's good, Natalie,
Yes.
at the outset, I'm happy to take any questions, but
Yes.
I will be very careful in making any personal advice. I hope you understand, the reason being that I'm not your physician and I can answer questions in a general term, but I cannot answer specific individual medical questions just for medical security reasons. But
Okay.
I think what may have happened, sir, is a fall is obviously a stressful event. I'm not sure if it's your first fall or maybe you've had multiple falls, but a fall is a stressful event. Tremor is a very good thermometer for stress. We have seen, for example, during this current COVID crisis, that general stress levels are up. Even I noticed this. But if you've got Parkinson's, your tremor may get worse because of the stress. Oftentimes it's a sign that something's going on. It could be a bladder infection, it could be moving house, it could be that your dog died or passed away, or the COVID crisis. The tremor is a thermometer signaling that something else is going on, and it could be the stress related to the fall. What I should tell you is that a tremor in general is a positive sign. People with a lot of tremor have a better prognosis than people with little tremor. And probably the tremor is a way of your brain to compensate for the slowness of movements. So tremor is a prognostically good sign. So I can understand your worries, but at the same time, there's probably something else, which hopefully is temporary, and tremor by itself is a prognostically good sign. So I hope this helps you a bit.
Thank you very much.
Okay, the next question from Catherine. She says it's very interesting, encouraging information, so thank you. And in general, is DBS something that's worth undertaking at the onset or at later stages of Parkinson's?
Yeah, that's a very good question. If you had asked me that question 10 years ago, we would have said we wait until as late as possible. So deep brain stimulation is a way to fight the treatment complications of oral pharmacotherapy, of the pills that you are taking. What is important to know is that deep brain stimulation is a highly effective treatment, but it will only improve symptoms that also respond to the drugs. So symptoms that have become resistant to the drugs or that never improved with drugs to begin with, will not improve with deep brain stimulation either. The only exception being tremor. Tremor can respond to DBS, deep brain stimulation, but not to the pills. So 10 years ago, we reserved deep brain stimulation for patients with bad fluctuations in the response to the oral pharmacotherapy. Due to recent insights, we are now pushing all the treatments for Parkinson's to an earlier stage, including deep brain stimulation. It still isn't a treatment I would give at the outset of Parkinson's, because you will always start with pharmacotherapy, with the pills. But as soon as there are fluctuations in the effectiveness of the pills, we begin to consider deep brain stimulation. The main reason is that once your treatments have become resistant to the pills, or once you've developed cognitive impairment, or once you've become too old, it's too late for DBS. So that's why we're pushing all the treatments to an earlier and earlier stage. I hope I've answered your question.
The next question we have is if you have any recommendations for diet.
That's another brilliant question. It's one of the most poorly studied areas, but I do have certain ideas about it. One of the most vexing problems for people with Parkinson's is constipation, lazy bowel movements. So anything you can do to promote your bowel movements is essential. Capital E, essential. So drinking enough fluid, at least 2 liters of real fluid per day, a diet rich in fibers is essential. That's number one. You need to have regular bowel movements. If you don't have regular bowel movements, see a dietitian. If it still doesn't work, see your general practitioner or your neurologist and ask for laxatives. Your bowels have to move. If your bowels don't move, the pills won't work as well as they should. That's one. Number two, it is good to spread the proteins across the day. You need proteins to build up muscle strength and in order to avoid weight loss, which is common in people with Parkinson's, but avoid peaks in protein because that may interfere with the absorption of medication in your gut. So rather than taking one big schnitzel of 0.5 kilogram, take 5 portions of 100 grams spread across the day. The third thing is, what is probably good is caffeine, if you like it. 3, 4, 5 units of caffeine per day. That's probably good. A Mediterranean diet is probably good. That comes automatically in Malta, but a Mediterranean diet is probably good. We talked a little bit about the pesticides. I eat organic food all the time. If you can afford it, consider organic food, or at least wash all the food that you're eating, because I'm very concerned about the pesticides in our food chain. And finally, milk products have also been associated with a higher risk of Parkinson's, again, because the pesticides may end up via cows or other cattle in the food chain into the milk products. You need milk products, particularly when you're a woman, because of the calcium for your bones. So don't get rid of the milk products altogether, but spread it across the day and avoid excessive milk products. That would be my advice.
All right, good. So everyone following the Mediterranean diet.
Yes.
Unfortunately, most people don't follow that, but hopefully knowing these information will be a good push for people.
Yes.
The next question from Veronica Clark. She said, thank you for this interesting presentation. I've read that the use of pesticides in Malta is similar to the rest of Europe, although I'm not sure if there is the use of paraquat. Do you have information about the use of pesticides in Europe? And also at a local level, what can we do to advocate for safer pesticides?
Again, a very good question. So it depends from country to country. So one particular concern is mancozeb, for example, which is widely used in the Netherlands today and across Europe. Mancozeb is the little sister, just chemically modified a little bit of maneb, which is very toxic, linked to Parkinson's, banned from many countries. But the little sister is used today. So, but it depends from country to country. So you may want to check your own country. But I think what I've done is, what you should do is what I've done is take the book. I'm just going to show it to you one more time. Here's the book. Take the book, send it to your politicians, tell them to read it and to take action. Because I think the time to wait and sit on your hands is gone. We're past that stage. There's a pandemic happening. We should act about it. So go to your local politicians, go to national politicians, show them the book, force them to read the book and to take action. You deserve it.
Yes, and then of course with that then is supporting organic as much as is feasible, as much as you can locally.
Exactly. And of course this needs to be done at a European level. I know you are a farmer, so I hope you didn't feel insulted. And again, I'm not.
We do everything organic, so.
All right. And again, I'm not blaming farmers. I'm not blaming farmers at all. They are the primary victims.
Yeah.
And in order to earn and to care for to provide for your family, they need to use these pesticides in a European competition. But I think we should drive organic farming at a European level.
Veronica also added on to that note, and she said, the facts about Parkinson's disease being a man-made disease in the book are shocking. I wonder if a person getting PD as a result of pesticides versus a person who has genetic or other causes will ultimately have any changes in the way their symptoms should be managed at all. So I guess in the form of a question, this would be, if you know whether it is from your lifestyle factors or from the factors of being genetics, do you have to manage the symptoms in a different way?
Right. The answer is very likely not. Again, 10, 20 years ago, we thought there was only one Parkinson's disease. We now think there are Parkinson diseases. There are genetic causes. So make no mistake, there are genetic causes. There are monogenetic forms of Parkinson's, which typically tend to hit people at a much younger age. Then we also think that certain genetic factors may predispose you, make you more vulnerable to exposure to environmental toxins. So both are happening. But ultimately, the way Parkinson's looks like at the outside is no different for a genetic form compared to an environmental form. It would be hard to predict from the outside what is the exact cause in you as an individual. And optimal care, whether your Parkinson's is genetic or whether your Parkinson's is environmental, is pills, multidisciplinary care, exercise, healthy diet, maybe deep brain stimulation, and a well-informed, engaged patient as a partner, regardless of the cause. The only thing that puts genetics apart is the counseling, because you can test for genetics, which, and by the way, we rarely do, because that opens up the possibility to test your family members. But since we don't have anything to offer to family members, it usually only causes anxiety and stress, and it doesn't help much. So the management is only different in terms of counseling and genetic testing. Otherwise, all the therapies apply equally to both forms of Parkinson's.
Okay, there are no more questions in the chat, but I have a question now. So you're saying there are these genetic tests that you can do. Say, for example, you are a younger person who does get this test and you find out because maybe your parent or grandparent has Parkinson's disease and you decide to find out if you have this gene for it. What would you suggest? Are there any preventative things that you can do as a young person, or is it the same kind of as you would manage the symptoms? Is it the same that you would do, or is it something different?
Right. So yeah. So this is one of the main reasons why we typically don't do a lot of genetic testing, because if you were young and healthy and you know that you carry a gene, and by the way, Sergey Brin, the founder of Google and the richest man on the planet, is one such person. His mother had Parkinson's. He had himself tested. turned to have a LARC2 genetic mutation, which he knows is a time bomb in his genetic material. And now what, right? So now you know you've got this time bomb and what to do. And there is no evidence to suggest what is wise, except what we recommend people is to exercise regularly, preferably on a daily basis. We know that exercise lowers the risk of Parkinson's. Cut on your dairy products, drink caffeine, and eat a Mediterranean diet. Those are 4 factors that are associated with a reduced risk of developing Parkinson's. And eat organic food and try to stay away from toxic chemicals like heavy metals, pesticides, and solvents as much as you can. Take preventive measures, wear protective gloves, wear face masks if you are in an industry that exposes you to these chemicals.
Okay. Can everyone hear me? I'm not sure if I'm muted or unmuted.
No, we can hear you.
Yeah, okay, good. So, are there any other questions? Does someone want to ask Bas anything else about the book? Okay, so then I would like to thank again Bas for giving this webinar and for doing this, so we can all, everyone's clapping for you. And I also want to add on, I have the book, so I really urge everyone to read the book, get the book. And if there's any questions that you have for those in Malta, you can always email me or message me or call me about any of the papers that he mentioned. I have all the information and yes, so well, Bas, thank you very much.
If I can just close by saying, at the least, go to the website and sign the pact.
Yeah.
The more voices, the better. If you decide to buy the book, which I hope, also give it a good review on Amazon, because a good review helps to promote visibility in this time of the corona crisis. I see a question. What is the website again, please? It's www.endingpd.org. I can actually type it here in the...
Ging je net doen, maar ben jij het aan het doen?
To everyone here.
In the wait, yeah.
I'm doing it now.
As he's doing that, a note that Catherine made, because people were asking about the pesticides use in Europe, it's actually 2.5 times the amount of pesticides typically used in Malta than the rest of Europe. So it's very heavily used.
Yeah. No, it's really a concern, and action needs to be taken. On the one hand, we need to take better care of the people already affected by Parkinson's.
Yeah.
But at the same time, we need to prevent the disease from happening in our fellow citizens who are still healthy today.
Okay, so everyone, so we have the website link there, endingpd.org, so we can all sign up. And also for those who are here, we have online classes to keep you moving every day from Monday to Friday on our website. This is via Zoom, so we can interact and see each other. And on Wednesday and Friday, we have a live class on Facebook. So we all keep active in this time of COVID. And as already Bas mentioned, exercise is very important, and also being interactive with other people so we don't slide into some kind of isolation. And we will continue having these classes online until we are 100% sure that COVID is gone, because we cannot risk meeting and risking that any one of you falls ill, and that would not be a good idea.
Just one quick item, before we close, to emphasize the importance of exercise. There is good evidence, good high quality scientific evidence to show that regular exercise, at least 3 times a week, but preferably every day, works like a drug in suppressing the symptoms. At the same time, we've got brand new evidence to suggest that maybe regular exercise can slow down the progression of Parkinson's. So if you were not already motivated to exercise and join Natalie's classes, now you should be motivated to the bone, because it stimulates the dopaminergic system, it suppresses the symptoms, and it may slow down the progression of your disease.
Okay, so everyone join. Tomorrow I'm teaching online.
Yes, you typically recommend twice per week, but now 5 times per week is the goal.
5 times per week, yeah, because we're not doing as much as possible. I just saw a few people coming in that I joined in from the waiting room. I had written on the Zoom that it was from 7 till 8:30. That was just because I didn't want to be logged off by Zoom, but the webinar is just only from 7 till 8, just so people know. So I hope everyone enjoyed it. Again, Bas, thank you so much.
Thank you.
Brilliant. And so for the rest, I wish you all a wonderful evening. If you have any questions, you can always email us or call us. And yeah, very good, Amy. And yeah, thank you very much. So then have a wonderful evening.
More than happy. Stay
Thank
healthy.
you. Thank you.
Thank you.
Bye-bye.
Bye.
Thank
Bye.
you.
Bye.
Bye. Bye. Thank you.
Bye.
Thank you.
Okay, I'm going to end it now. Bye.
Ciao.
Thank you.
Bye.